9 vegetables that elderly people should absolutely not eat or they will bring disease into the body. Health is the most valuable asset, especially when we enter middle age and old age. When the body is no longer as active as when we were young, seemingly harmless eating habits can become the silent cause of harm. Among them, vegetables, which are considered healthy foods, also need to be carefully selected. Some vegetables, although rich in nutrients, pose potential risks to the health of the elderly, from causing blood sugar disorders, affecting kidney function, to stimulating arthritis. Based on content from the Try Tuesday Hien Triad channel, this article will analyze in detail 9 types of vegetables that the elderly should limit, the reasons why, and the secrets to healthy living to maintain a strong body and a clear mind. Why do elderly people need to be careful with vegetables? Vegetables are a source of essential fiber, vitamins, and minerals, which play an important role in maintaining health. However, as the body ages, organs such as the kidneys, digestive system, and thyroid gland function less effectively. Vegetables that were once suitable at age 30 can cause problems such as bloating, arthritis, or blood sugar disorders when you are over 50. These effects occur silently, making many people not realize that the cause of declining health lies in their daily meals. The video from the channel Health of Old Age 24H pointed out 9 familiar vegetables that can be harmful if consumed incorrectly. At the same time, the video also provides signs of kidney health and warnings about foods that cause hyperlipidemia. This article will expand the content, explaining in detail each type of vegetable, the mechanism of harm, and alternative ways to protect long-term health. 9 vegetables that seniors should limit. Here is a list of 9 vegetables that seniors should consider adding to their menu, along with scientific reasons and ways to adjust their diet. Peas, risk of hyperglycemia and gout. Peas are a popular food in soups, salads, or stir-fries. With a mild sweet taste, peas are rich in fiber, protein, and vitamins, and are considered by many to be a nutritious choice. However, for the elderly, this type of bean poses 3 main problems. High glycemic index. Peas have the ability to quickly convert into sugar, causing a sudden increase in blood sugar. In the elderly, the ability to respond to insulin decreases, leading to difficulty controlling blood sugar. Regular consumption can increase the risk of type 2 diabetes, accompanied by symptoms of fatigue and lack of energy. High purine content. Purines in peas are converted into uric acid in the body. In young people, the kidneys easily excrete uric acid, but in older people, kidney function declines, causing uric acid to build up, leading to gout or kidney stones. Pain in the big toe or foot can be a warning sign. Difficult to digest. Peas contain resistant starch and lectins, 2 compounds that are difficult for people with weak digestive systems to break down. As digestive enzymes decrease with age, these substances ferment in the intestines, leading to bloating, flatulence, or excessive gas. Tip: limit peas, especially if you have a history of diabetes, gout, or digestive problems. Replace them with easily digestible vegetables such as spinach, pumpkin, or kale. If you still want to eat them, boil them thoroughly and eat them in small amounts. Asparagus nourishes the body but can strain the kidneys. Asparagus is considered a high-class food, rich in antioxidants, fiber, and vitamins A, C, and E. This vegetable supports the cardiovascular system, slows aging, and often appears in luxurious stir-fries or soups. However, for the elderly, asparagus is not completely safe. High purine. Similar to peas, asparagus contains purines, which are converted into uric acid, increasing the risk of gout and arthritis. Pain after a meal with asparagus can be a sign that the body is reacting to purines. Strong diuretic effect. Asparagus stimulates urination, which is beneficial for young people but dangerous for the elderly. After the age of 50, the body is prone to dehydration due to a less sensitive thirst sensation. Dehydration causes fatigue, dizziness, cramps, and increases pressure on the kidneys, especially in people with a history of kidney disease. Tips: limit asparagus, especially if you have kidney problems or gout. If you eat it, boil it thoroughly, use small amounts, and make sure you drink enough water. Replace it with kale or zucchini, which are gentler on the kidneys. Corn. delicious but difficult to digest, and increases blood sugar. Corn is a familiar food, from boiled corn, grilled corn, to stir-fried corn, with a sweet taste, long-lasting and rich in fiber, vitamin B and magnesium. However, for the elderly, corn poses potential problems. Difficult to digest, the outer layer of corn kernels contains cellulose, an insoluble fiber that is difficult for the digestive system of older people to break down. This causes bloating, flatulence, or constipation. Many people find the kernels intact in their stool after eating corn, a sign of digestive difficulties. High glycemic index. Corn has the ability to increase blood sugar quickly, similar to white rice. For people with a history of diabetes, eating corn regularly causes fluctuations in blood sugar, leading to fatigue, irritability, and long-term nerve damage. Omega-6 content. Corn contains omega-6, if consumed in excess, can cause inflammation, affect the cardiovascular system and joints. Corn quality. GMO corn or corn exposed to pesticides, such as glyphosate, can unbalance the intestinal microflora and affect kidney function if accumulated over time. Tips: prioritize organic corn, eat in moderation, and prepare it simply, such as boiling or steaming. Replace with pumpkin, broccoli, or chayote to aid digestion and control blood sugar. Cabbage affects thyroid and digestion. Cabbage is a rustic vegetable, rich in fiber, vitamin C, and antioxidants, often appearing in boiled, stir-fried, or rolled dishes. However, the elderly should note, contains goitrin. Goitrin in cabbage interferes with iodine absorption, affecting thyroid function. People with hypothyroidism may experience fatigue, weight gain, or cold hands and feet if they eat too much. Indigestion. Cabbage contains raffinose, a complex carbohydrate that ferments in the intestines, leading to bloating, flatulence, or abdominal pain in people with weak digestive systems, especially those with irritable bowel syndrome. Tip: there is no need to eliminate cabbage completely. Boil, steam, or ferment, such as pickles, kimchi, to make it easier to digest and reduce the impact on the thyroid. Substitute with spinach, zucchini, or Malabar spinach if you have digestive or thyroid problems. Eggplant causes inflammation and increases risk of kidney stones. Eggplant is a popular, soft, flavorful, low-calorie vegetable that is often roasted, braised, or made into soups. However, for older adults, contains solanine. Eggplant is a member of the nightshade family and contains solanine, an inflammatory compound that can aggravate arthritis, gout, or joint pain. Sensitive people may experience stiffness or numbness after eating it. Contains oxalate. Oxalate in eggplant promotes the formation of kidney stones, especially in people with poor kidney function. Indigestible, eggplant skin and seeds are difficult to break down, causing bloating, acid reflux, or dull pain in people with sensitive digestive systems. Tips: cook thoroughly, peel, and eat in small amounts. Replace with pumpkin, squash, or zucchini if you have joint or kidney problems. Potatoes. Risk of hyperglycemia and inflammation. Potatoes are a favorite food, from boiled, mashed, to fried, with delicious taste and long-lasting. However, for the elderly, high glycemic index, potatoes quickly convert to glucose, causing a sudden increase in blood sugar, dangerous for people with diabetes or metabolic disorders. Contains acrylamide when fried. Fried potatoes produce acrylamide, a substance that causes inflammation and is associated with cancer risk. Loss of fiber when peeled. Peeling increases the rate of sugar absorption, causing hunger and difficulty controlling weight. Tips: keep the skin when boiled or baked, eat in small amounts, and do not fry. Replace with sweet potatoes, which have a lower glycemic index and are rich in antioxidants. Spinach, kidney stone risk. Spinach is rich in vitamin K, iron, and antioxidants, and is often stir-fried, cooked in soup, or juiced. However, contains high oxalate. Oxalate combines with calcium, forming kidney stones and reducing calcium absorption, affecting bones in the elderly. Tips: boil and discard the first water to reduce oxalate. Combine with calcium-rich foods such as yogurt. Replace with spinach, jute, or water spinach. Kale affects kidneys and thyroid. Kale is rich in vitamin C, calcium, and antioxidants, and is popular in salads or juices. However, contains oxalate, causes kidney stones, especially in people with weak kidneys. Contains goitrin, inhibits iodine absorption, affects the thyroid, causes fatigue and weight gain. Tips: cook thoroughly, eat in moderation, and combine with other vegetables such as broccoli, pumpkin. Avoid eating raw regularly. Bell peppers, causes inflammation and indigestion. Bell peppers are rich in vitamin C and beta-carotene, often used in stir-fries or salads. However, thick skin, difficult to digest, causes bloating, stomach reflux in people with weak digestive systems. Contains solanine, stimulates inflammation in sensitive people, aggravates arthritis or gout. Tips: roast, peel, and eat in small amounts. Replace with zucchini, carrots, or broccoli. General tips: eat smart. The above vegetables are not completely harmful, but need to be processed properly, boiled, steamed, cooked, peeled, and eaten in moderation. Elderly people should prioritize easily digestible vegetables such as spinach, pumpkin, Malabar spinach, or broccoli to protect the kidneys, digestion, and reduce inflammation.